kabaka wa Buganda sibalamula mwari muno mwari kabaka wa Buganda sibalamula ayise basajja n'onswa amagulu nnyondo sekwanga musota lukomana tawe twabere mwari muno mwari kabaka wa Buganda sibalamula nze musajja wakuyimbira kazini owevuma ndi mutabani wa kabengule eri mulemezi mwari muno mwari kabaka wa Buganda sibalamula tuwulira bubi baffe n'otunyola nnyo olw'obuwanga n'ebyaffe ebyebisalawo mwari muno mwari kabaka wa Buganda sibalamula ekyama kya Buganda kikyo kisalawo tunakola tutya Obuganda okununulwa mwari muno mwari kabaka wa Buganda sibalamula.
Uganda, like many parts of sub-Saharan Africa, suffers a number of life-threatening diseases including malaria, pneumonia, measles, diarrhea and HIV/AIDS, which affect young and old alike. Many people have therefore embraced traditional medicine as an alternative healthcare system to prevent as well as cure many common ailments. In some parts of Uganda, traditional healers have come together not only to improve their practice but also to increase the supply of the much-needed herbal mixtures to their community. The situation is similar in most sub-Saharan Africa and Asia, where practitioners of traditional medicine have also recognized the need to document and prove the efficacy of traditional medicine in their communities.
When we look at traditional medicine in its totality, it is actually very difficult to define it. There are many elements in traditional medicine that cannot be understood, that cannot easily be defined, especially when we have the Western framework within our minds. But in its totality, traditional medicine it's a healing system that uses parameters beyond our human senses. The senses of smell, touch, feel, hear and see, beyond that.
Statistics from World Health Organization show that more than 80% of Africans and 85% Asians routinely use traditional medicine for primary health care and depend on medicinal plants for nutritional supplements.
This medicine is readily available. It is less costly than modern medicines, and to many people it is also culturally acceptable. People feel comfortable when they take traditional medicine. But of course it depends also on the disease and the cultural beliefs.
While Uganda has been hailed internationally for the most effective national anti-AIDS campaign so far, providing care and treatment to people living with HIV/AIDS remains a problem, with many people living in rural areas where antiretroviral treatment is not easily accessible nor affordable.
The problem we have with our Western medicine, to give you ARVs in Uganda, because of the economy, you must be below 200 and below. Whereas in the America, North America, Canada, where they start giving you ARVs when you reach 400.
In many local communities, traditional healers are respected elders or spiritual leaders and know how to convey health information in a culturally suitable way.
The way now we are using our culture in training programs, it's very fruitful, and even the community can understand more than in the modern ways.
Not only are the traditional healers more approachable than Western medical doctors, but some of their products have been found to be quite effective.
For example, in Tanga town, there is a group called the Tanga AIDS Working Group, which has for more than 10 years now been providing concoctions to HIV/AIDS patients And in this group, we have been doing quite a number of follow-ups, and we have found that people who are using these concoctions, the quality of life is improving, the viral load is going down, CD4s are improving, and opportunistic infections are disappearing. And we have been comparing with the group in ARVs. We have found interesting results that the herbal medicines are competing favorably in the treatment of HIV/AIDS, same as the ARVs.
Apart from the HIV/AIDS epidemic, about 40% of the morbidity and mortality of Africa's population is accounted to malaria. In India and elsewhere, more people die of malaria than of HIV/AIDS.
365 people are dying every day from malaria because the figure overall is beyond 100,000 per year. So the morbidity levels are proportionately even higher then, because if 365 people are dying daily, so it means many more people are falling sick of the disease.
First-line primary health care is therefore necessary, and most rural families find medicinal plants easily accessible to treat the disease.
We have done some researches, I and the colleagues in Mulago, and we have come up with a substantial amount of materials that are used to treat malaria. So the knowledge of how to treat malaria exists within the country.
In India, folk healers and practitioners of Ayurveda medicine have focused their model on the old adage that prevention is better than cure.
At the moment, government is starting to support. The Department of Science and Technology has offered us a project for prevention of malaria using herbal medicines.
In May 2010, Prometra Uganda, a local NGO that has been involved in research and training for traditional healers, hosted the Afro-Asian Learning Exchange and Workshop on the documentation of local health traditions.
Nakyagala nnyo kubanga era bakyogerako ekyokukuuma ebitabo okufollowinga ebitabo byammwe abalwadde n'omanya avuddewa myaka emeka n'eddoozi z'owa muki omulwadde oteeka okubanga nazo ozigira ki ozimanya n'okuba nti oteekateeka eddagala lyo n'omanya nti kati nteeseteese eddagala lyange buli mulwadde waagira liba weeriri. Ekirala okuba abayonjo mu ddagala, eddagala n'obeera nti eddagala lyo liyonjo n'okumanya enkungula y'eddagala.
Ekirala era kye nayiga nalaba nti kya mugaso nnyo okukolagana n'abantu abalala abamanyi, era n'ekirala kye nayiga nti bannaffe ab'omu nsi ez'ebweru tufaanana bwe bituuka ku ddagala ery'ekinnansi kumpi tulina enkola y'emu.
From their experience at home, participants from India are convinced that when practitioners document their knowledge in their own language, it will be easier to engage scientific researchers in proving that traditional medicine works and for policymakers to incorporate it in the national health policy. In some African countries, traditional medicine has been nationally recognized and accepted to complement Western medicine in health strategies. Ghana, for instance, has a national policy which allows traditional healers to practice if they are registered.
There's an existing policy, there's a council for traditional healers, so there's no problem with the doctors sort of referring or making transfers. No restriction on the part of government.
In Tanzania, traditional healers work with the government and research institutions to standardize traditional medicine as an acceptable alternative for treating opportunistic infections in people living with HIV/AIDS.
Our healthy policy recognizes the right of the patients to receive medical care, modern or traditional.
In Uganda, traditional medicine continues to face antagonism from Western medicine proponents, the community, and the government alike.
Our system is presently defined by the negative elements. It's presently associated with witchcraft. It is presently associated with poor hygiene. It is associated with the backwardness. It is associated with the unreligiousness, and it's for uneducated people.
The increasing number of fake traditional spiritualists who con patients of their money and property and sometimes involve themselves in human sacrifice have made the situation worse.
Tulebere nti no tujibwamu abasawo abalabika nga babikwangala abaliwo n'omulimu gwaffe kubanga ffe tuli basawo abaagala okuvumula abantu ate bwe tuwulira nga ate bagamba nti tuli basawo ate abalumu abatonoonera omulimu gwaffe nga mu kifo ky'okuvumula ate baagala kujja obulamu bw'abantu awo ffe kyekisinga okutuluma.
Genuine traditional healers, on the other hand, face the challenge of making a living out of traditional medicine as a full-time practice because their operations are not legalized.
The first category, as you say, are those ones who are at home, okay, whereby they simply go to the field and pick up the leaves and make, as he said, concoction. I would not make it a concoction. And make their medicine and give it to their patients. As NDA, we decided at the moment we cannot regulate those people.
But on average, perhaps each healer is getting 5 patients, and this is a person with a family. He's a real physician, so to speak, just like a physician in Mulago who has got a family, and all the attendance costs. But he gets 5 patients. His colleague in Mulago gets 50 every day. This one gets 5 maybe a day, and he's not being paid, the same way this other person is being paid. So there's a problem that the market for the traditional medicine and the respectability is low.
Uganda and other countries could draw on the experiences of India, where documentation and assessment of local health traditions has been used with great success to achieve national recognition and support of traditional medicine in the control of malaria and other common infections.
We have a national council and a separate department under the Ministry of Health and Family Welfare, which takes care of traditional medicine. And there is a minister who is in charge of traditional medicine under the Ministry of Health and Family Welfare. We don't have a separate ministry, but it is under the modern medical wing.
Indeed, there is a wealth of indigenous knowledge and experience, as well as scientific research findings, which, if well documented, could draw the attention of policymakers to the opportunities and effectiveness of traditional medicine.
I would like to see that when I make my concoction of malaria, put it in a nice vessel, I put it on the shelf, I get 2,000 shillings, just the way a bottle of Panadol costs. And I should be happy to see that I can sell this frequently. Every week I should be able to sell enough to sustain me.
The single most important, if you asked me one, is to research and understand the system. Then to help the system to regulate itself. And then avail ability of the system to find financial assistance for the system to develop itself. And possibly, lastly, to see how we can institutionalize the system.
As far as traditional healers will reach in documenting and assessing the safety, efficacy and standardization of traditional medicine, so far shall the policy agenda on traditional health be advanced in Uganda and Africa at large.
I make an appeal to the relevant authorities to understand our traditional healthcare system and understand us, the practitioners, within our own format, within our own framework. Don't impose foreign frameworks into our system.
mwari muno mwari kabaka wa Buganda sibalamula mwari muno mwari kabaka wa Buganda sibalamula ayise basajja na unswa amagulu nyondo sekwanga musota lukomana tawe twabere